So here's something to think about. You need to lower your cholesterol, so your doctor puts you on Lipitor. Or you have a bad infection and you need one of those black label antibiotics. Would you want to know if this medication could possibly damage tendons or other soft tissue? And if you were told there would be possibly long-term damage, would you want to try another route? So this has happened to two people I know. One person can't open his hands anymore because he took one of those black label antibiotics, and another colleague had terrible ankle tendinopathy because of another drug that she took. So here to talk about the potential downside of some of these commonly prescribed medications is Robert Markison. He's a hand surgeon who has nearly 40 years of experience and is a clinical professor of surgery at the University of California, San Francisco. And he's really got some interesting things to say about these medications. Let's start maybe with Lipitor, Dr.
Again, I'm not the anti-statin and I'm not a cardiologist, and there are a lot of people who do need them. There are some ways to mitigate the negative side effects of statins. But if you think about statins, I guess they were first patented in 1987. So we're plenty of years into statins, and some are said to be more body friendly and maybe heart friendly. But the fact is that as soon as you interrupt the biosynthetic pathway that will make cholesterol and things with a cholesterol backbone, then you also start to interrupt. So here's Rob Peter to pay Paul. You end up reducing your capacity to make coenzyme Q10. And what's that? CoQ10 is the rate limiting enzyme in the formation of all energy, which is ATP, adenosine triphosphate. Your basic biology class taught you about oxidative phosphorylation. That occurs in little mitochondria, these beautiful little ovoid microsomes that live in 25% of the volume of each of your 3 trillion cells, including 86 million in brain. And so the mitochondria are the power plants and the drug metabolizers and so on, but they make CoQ10 in order to start off the chain reaction to get to raw energy, ATP, by high energy phosphate bonding to give you that power that powers all reactions, whether you're thinking brain synapses or whether you're moving muscles or doing other hypermetabolic things, beating your heart and so on. And so in order to reduce cholesterol lipid formation and get better looking numbers and theoretically less atherosclerosis, coronary trouble and brain trouble and so on, you start to go into a little power failure. And so if you take supplemental CoQ10, you'll probably reduce some of that tendency. The first article was 2005, where people went off statins and switched to CoQ10 without adverse effect. That was 50 consecutive cardiology patients suffering the typical 25 to 33% prevalence of statin side effects. So I got interested, started in the late 1980s through the 90s and forward, seeing tendinopathies. And they were mostly trigger digits, often multiple, in the hands of statin consumers. We'd see Achilles tendon ruptures at about 2+ prevalence of non-statin consumers. Somebody takes a walk, somebody plays tennis, they snap their Achilles, and they've got trouble. And then later on, in the hand surgery literature, we noted that there's a 2x increase in biceps tendon rupture, spontaneous biceps rupture, among statin consumers. Those are big print editions of tendinopathy, smaller print, single, multiple trigger digits. And so following that and having patients complain of some memory loss, short and long term, patients complaining of general weakness and neuropathy as well. I thought, well, okay, talk to your cardiologist, maybe lower the dose, certainly take coenzyme Q10 if you've got coincident problems, thyroid, diabetes, and so on. Make sure you're tuned up as well as you can be. So statin tendinopathy, statin neuropathy, occasionally statin arthropathy, watch out for it. The prevalence 25 to 33% if the cardiologist is honestly reporting it. It doesn't mean be afraid of statins, just be aware. Because you might take niacin, you might take a low lectin diet, you might take CoQ10, and you might turn up with better lipid levels because you've gone gluten-free and gluten is a lectin. And so you've kind of gotten that holistic but very legitimate approach to capping hyperlipidemia.
That's good advice. I think, very often people don't understand the power of diet and uh, other things that they can do rather than taking a very strong drug. What about these so-called black label antibiotics?
Well, I mean, we were happy with Keflex and first generation cephalosporins and so on for infection, but as things ramped up and drugs tried to keep up with bugs, then we got to fluoroquinolones. And the most commonly prescribed culprit is ciprofloxacin. And again, I'm not saying it's the devil, but many, perhaps most of my patients who take Cipro, even briefly, start to get tendinopathy and aches and pains beyond what they want or deserve. And so it's a question of, do you need a fluoroquinolone, or do you have an infection sensitive to the lesser generations, earlier generations of antibiotics? And so that's very common. Cipro and its friends related tendinopathy, neuropathy, and other side effects.
And with antibiotics, don't you have to take the full course to be safe rather than risking having it come,
Yes, probably. Yes, probably. But I think people are going to start lowering doses and perhaps shortening courses and then just following things along. Obviously, we're in a viral pandemic, coronavirus right now. And so you don't want to do anything to lower general resistance, and you don't want everything that has a fever to be dismissed as coronavirus, because you may have something totally separate. And a number of my patients have come up with sometimes life-threatening conditions that were not corona, that needed extra thinking beyond the common parlance, oh, it's a little corona, because they've had some serious bacterial infections.
Yes, a lot of people with RSI have also had to cope with breast cancer, and they're taking aromatase inhibitors, such as tamoxifen and aromatase. Can you talk about the side effects of those medications?
And here again, if you've got estrogen positive tumor, then used to be tamoxifen, now they've ramped up to the aromatase inhibitors, but the evidence-based non-financially interested medical literature confirms 15 to the highest level of 60 to 65% prevalence of aromatase inhibitor-associated tendinopathy and arthropathy. And so that's pretty serious. I mean, if you told somebody crossing the street there's a 60+% chance of trouble, they might think twice. So in that case, the question for the prescribing oncologist is, could we lower dose? Is it necessary? Could we back off to tamoxifen, talk it over? Because I'm regularly replacing thumb carpal metacarpal joints, releasing tendons, and so on for patients who have had unilateral, bilateral breast cancer, and they're in a long-term regimen. I don't mind chasing drug side effects with a scalpel, but a lot of this stuff could be preventable. It requires a deep discussion and some pharmacovigilance.
Yeah, preventable is the key word here. And lastly, people might be prescribed steroids for conditions such as arthritis, asthma, lupus, and certain cancers, or use them actually to increase muscle mass, which I would never recommend. So tell us how those steroids can affect soft tissues adversely.
Well, you can weaken tissue, and the question obviously is, in the interest of controlling autoimmunity, you may suffer prednisone side effects, which can be tendinopathy, neuropathy, swelling, not just the moon face of chronic prednisone consumption, but some other things that happen in the periphery. Here again, I'm not a rheumatologist, but I must keep up with that literature and other domains that negatively or positively impact the hand. A very low dose of prednisone is probably fine. Higher doses, you start to wonder. And again, it's the holistic but legitimate question of, have you addressed diet? Are you on a low inflammatory diet, meaning low lectin diet? Have you kept up your microbiome, which weighs almost as much as your brain? And so you've got 10 times the DNA in the microbiome, including intestinal bacteria that can be very friendly or very destructive. Are you taking a probiotic? Do you take a prebiotic to feed it? Are you up on your vitamin D and other vitamin levels, trace elements? Is your thyroid working? Is your pancreas working so you don't need insulin or glucose lowering drugs? Have you gotten down to lean body mass without over exercising? And so these are all the things that sort of factor into how autoimmune are you? And we have a big involuntary parcel of education now with the COVID epidemic, where people are starting to understand that human beings are a nested set of immune interfaces walking through time, space, and potential trouble. So the art of it is to try and keep out of trouble. Obviously, the big winners are going to be able to non-invasively monitor cytokines, which are destructive and cause the storm and death. So we have a lot of opportunities here, to be honest with you, but it does involve some cross-domain thinking in the care of patients before you have a knee-jerk response of writing out a prescription with associated risks.
Well, what you just said about vitamin D, how's your microbiome, and the various things that you laid out a few paragraphs ago seem like a good sign. So if a patient is in an interview with a doctor, if the doctor is asking, you know, how's your diet and have you, you know, how's your CoQ level and that sort of thing, that would be a good indicator that the doctor is thinking preventively, like, I don't want this patient to possibly have a side effect. Is there something else we can do first?
Oh, I agree. I mean, if we had the commonsensical approach of Hippocrates, who lived from 460 BC to 375 BC on the island of Kos, K-O-S, off Asia Minor, a pure genius, a futurist out of place and time. Food is fuel, food is medicine. Can we be commonsensical again? He didn't have access to a whole world of specialists, but he was a genius working in isolation. So let's get back to commonsensical thinking before we jump to prescription pads.
Very good, very good. Thank you so much for this information, Dr. Markison, and thank you for coming on the show and answering our questions.
Always
Thanks
a pleasure.
everybody for watching, and we'll see you next time.